Hello everyone, this is Dr. Raghuvamsi and I'm the Chief Surgical Oncologist at HCG Cancer Center, Visakhapatnam. I am here to discuss on COVID vaccination for cancer patients. We are all aware that the vaccine has come as a boon for us to fight the COVID-19 pandemic. But I still see a lot of hesitancy and worry among my cancer patients and their relatives if they have to take the shot. So we need to understand first what exactly is a vaccine. It is a biological formulation which is given to improve your immunity and increase the antibodies to fight COVID-19 infection. This may prevent it altogether or reduce the incidence of severe infections. In the real life experience and also in trials, we have seen now that the vaccines available are quite safe. So there's nothing to worry for normal people and also the cancer patients. We have a tendency, or in general, people have the tendency to put all cancer patients into one block. It is not like that. Different cancer patients have different levels of immunity and responses. I'll be discussing primarily on breast cancer because that is the cancer which I get a lot of queries on. To start with, I have been recently diagnosed with cancer and have recently recovered from COVID. Do I need the vaccine? Like for the general population, a person who has recently recovered from COVID does not need to take the vaccine for at least 3 months. Beyond that, the antibodies can be tested and if need be, vaccine can be taken. A newly diagnosed cancer patient need not worry about their treatment. Before their treatment starts too, they can take the vaccine for sure. Cancer survivors who have completed their treatment can definitely take the vaccine like any other normal person. Coming to the specifics, I have been recently diagnosed with breast cancer and I have been advised surgery. Can I take the vaccine? Of course you can. If your surgery is scheduled immediately, go ahead with your surgery. Probably a couple of weeks or after the recovery, 2 to 3 weeks, you can take the vaccine like any other normal person. If you have time, you can take the vaccine. Preferably keep at least 3 to 5 days before your surgery because you will develop some sort of side effects, either a fever or myalgias or so on. What we need to understand is not all cancer patients are the same. You definitely need to be careful for patients with stage 4 disease and patients with blood cancer or hematological disorders. For these patients, they also can take the vaccine but with the guidance of the oncologist. Please don't hesitate in taking your shot just because you have cancer. If you have a doubt, consult your oncologist and take part in this fight in eradicating COVID-19 pandemic. Take care. Thank you.